To ease his pain, Dr. Williams returned to Providence as chief surgeon. The facility he founded had expanded into a 65-bed hospital and was in a new building. It had been reorganized so that committees of the board and staff members ran day-to-day functions. The same doctor he rejected earlier, that he was forced to hire, was now an influential member of the board and on many committees. Dr. Williams also rejoined the medical association he enjoyed participating in before he left for Freedman's. Other hospitals sought his expertise. By 1900, he was caring for black and white patients on staffs in 5 hospitals. As his reputation for being an outstanding surgeon grew nationally, he was contacted by black doctors eager to learn. They paid his travel expenses to visit them in rural areas to operate on their difficult cases. Since there was not a hospital, Dr. Williams operated any place he could. News of his strong commitment to improve black medical care reached the South, and Meharry Medical College in Nashville, Tennessee, offered him a position to teach surgery and demonstrate operations.
He went to Meharry. He held a series of clinics, teaching clinics, to instruct medical students and other physicians in the surgical techniques that he had developed. He was a clinical professor of surgery at Meharry and held weekly clinics for a period of time. So he understood that institution building was a very important part of trying to address the healthcare needs in the South.
In Meharry's operating room, Dr. Williams performed 6 to 8 operations a day by lamp and candlelight. He knew this was inadequate and that blacks in Nashville needed a hospital. It could also be a place for training black interns and nurses. During this period, segregation prevented blacks from entering white hospitals in the South.
This is during the time of Reconstruction and beyond, not very many years after that phase. Remember, the Civil War stopped in 1865, Reconstruction after that. 1880s, the Northern troops were withdrawn from the South. That was around the time of the Hayes-Tilden Compromise. And subsequent to that, all of the Jim Crow, sharecropping, and other issues were developed to help to maintain slavery, but in another form. And so you can imagine that the health problems that black people faced during that time were just awesome. The infections that I mentioned, the poor sanitary conditions, the lack of access to physicians. Bear in mind, this is many years ago, but bear in mind that even during slavery, there was a syndrome, a clinical syndrome that was written up in the medical text called drapetomania. It was actually felt that slaves were sick if they wanted to run away. And so runaway slaves were diagnosed as having an illness, a clinical illness. And so that's the legacy, that kind of puts it into perspective. That's the legacy from which Southern blacks had to contend after the Civil War and after Reconstruction. So things were very tough, very, very tough. But in spite of that, there were many blacks, men and women, who worked very hard to address some of these needs. Dr. Williams was one.
January 23, 1900, Dr. Williams spoke at a public meeting in Nashville. You can and should at once establish a hospital and training school for nurses in this city. Nashville is noted for its educational institutions, its cultured people, its wealth, its beautiful homes, its medical institutions, and the number and capability of its physicians and surgeons. Start at once this educational and humanitarian work. Every city in the South with a population of 10,000 colored people should have a hospital and training school. A hospital of 25 beds, properly managed, is almost self-supporting. You will have many things discouraging with which to contend with at the start. Chief of all is lack of confidence in each other. This has always been a deterrent element in our race relations. The ignorant and naturally suspicious will have to be gradually induced to relinquish their unquestioning faith in the infallible skill and judgment of the white man. On the other hand, we must demonstrate our right to confidence. We must not be satisfied with erudition. We must have knowledge. Do not be deterred by the thought of antagonism. Few enterprises, even those having for their objective the betterment of mankind, have smooth sailing from the start.
There's no question that the people who have helped to start medicine, meaning Africans, have helped to build pyramids, meaning Africans, have helped to introduce various herbs and other drugs that are healing drugs, Africans, that these people are just as competent, just as brilliant as any other people on the face of the earth. But during slavery, that thought was not given credence. In fact, just the opposite. We were told that we were subhuman, that we were no better than cattle, and we were treated as such. And so what Dr. Williams understood was that as a people, we would have to provide for our own in terms of health care if we were to ever break or destroy that myth that had been developed during those slavery times.